I want us to do this. For that person listening to us now, and he's probably heard the conversation about hypertension, high blood pressure, why should he or she be concerned? Dr. Agyekum.
Thank you very much. Simply put, you should be concerned because hypertension is a silent killer. It is the number one cause of stroke globally, the number one cause of heart failure, the number one cause of heart attack, and the number one cause of kidney disease. So if you want to live longer, you should be concerned about hypertension.
Dr. Tagoe, what do you say?
I go for the same thing. And I also want to add that, especially for our women who get hypertension in pregnancy, when they deliver and they start taking care of the babies, they forget about themselves. Do not. The BP doesn't go away easily like that. You have to keep monitoring. When you realize that it's coming up again, you have to take medications. Otherwise, they are the same risk of stroke and kidney disease in a few years to come.
The young ones, the men, the boys, they say that, oh, this is for old people. They don't really, so when I'm growing old, I'll stop all the bad things I'm doing, then I'll live longer. Is that the case?
No. Children can even get hypertension. My youngest patient, I'm an adult cardiologist, so my youngest I see people who are from 12 years and above. And my youngest patient with hypertension was a 16-year-old lady.
16 years?
16-year-old lady. I have had in the 20s, many of them. In the 30s, a lot of them. It is true that as we age, our risk of developing hypertension increases. So if I take people who are below 30 years, the prevalence of hypertension will be lower than those who are between 30 and 60 years. For people who are, say, 30 to 70 years, if you take 10 people, about 3 to 4 of them will have hypertension. Go to people who are like 80 years. If you take 10 of them, about 8 to 9 of them will have hypertension. So as we grow, hypertension increases, but younger people also develop hypertension.
What has changed? Like you're saying, but a 16-year-old person, would have thought that, like you say, between 30 and 70, even there you're looking at, 50 going would have these challenges. How come? What has changed?
Okay, that brings us to the causes of hypertension. So we have the primary causes and the secondary causes. So those who are younger, they may have conditions like being born with kidney disease already or some form of heart condition already that can predispose them to hypertension. And then when it comes to for the causes, we divide them into modifiable risk factors and the non-modifiable risk factors. So the non-modifiable, you cannot do anything about. That's the advancing age. You may have a family history of a first-degree relative, like your father, mother, or another sibling who has hypertension. That places you at a bigger risk of also developing hypertension at an earlier age, like from their 30s. And then, just by being black. And then when it comes to the modifiable ones, the ones that you can do something about. Nowadays, we are all very sedentary. We are driving everywhere. We are not walking enough.
Hold on for me on that one. I like the modifiable ones because that's the one that young men and women of today are interested in, and that's the one that is getting a lot of them, with hypertension. So let me get back to Dr. Tagoe and Dr. Agyekum. So we're talking about the causes, and that's very, very important to me. We've looked at hereditary stuff in here and there. But let's look at our lifestyle.
Modifiable
risk factors. Yeah. Tell us, yes, Dr. Tagoe.
So the modifiable risk factors, they include being physically inactive. Nowadays, we are driving everywhere. Okay. We are not walking enough. And even if we are driving, we should find time within the week to have some exercise. The ESC, that is European Society of Cardiology, they recommend that you should have at least 150 minutes of exercise, moderate intensity exercise, and strength training per week. So even if you drive, make sure that you find time within the week. Also, our diets are so unhealthy. We are eating food with too much salt in it. We are eating too much carbohydrate. And once you also have a sedentary lifestyle and you are eating all of this food, it is going to be stored as fat. Everything that you eat, that goes into your body, and you are not able to exercise to bring that out, it will be stored as fat. We are not eating enough vegetables. We are not eating enough fish. So we need to look at these situations at all. And we are eating too much of the burgers, the pizzas. All those ones must also come down. We have to replace them with fresh fruits and vegetables. Also, People have certain habits like smoking. This continuous smoking tends to destroy the surface of your blood vessels, and they increase the pressure against which the heart must pump for blood to go to all your organs. Other people are also taking in cocaine. Cocaine can also increase your blood pressure, as well as the alcohol. I have friends. I talk to them about this, and they tell me that, doctor, as for the whiskey, dear, I can't stop. As for the whiskey, don't go there. You can tell me anything, but you have to stop. If you cannot stop, just start bringing down small, and that would help to bring down your blood pressure.
Those who say as for the alcohol they can't stop, yes, I want us to focus on that, because why must they stop?
They must stop because this continuous intake of alcohol tends to destroy what we call endothelial dysfunction. It will destroy the surface of the blood vessel, and this will cause other, because you're also eating uncontrollably, you have cholesterol depositing, you have other things in the blood like your platelet depositing. All these things lead to distraction, narrowing of the blood vessels. Some also form clots in the blood vessels, and this may lead you to have a heart attack. These clots can also travel to your brain, and then you have a stroke as well. And when you have a stroke, you're just lying there. People have to take care of you. They have to change your diapers. It's very difficult. You were strong today, and then tomorrow you are just lying there, unable to do anything for yourself.
Dr. Agyekum, yes.
In addition to the alcohol, not just the heart, in addition to alcohol leading to hypertension, it can also weaken the heart muscles and cause heart failure. Alcohol can also affect your liver and cause chronic liver disease, make the liver hardened, not able to work again. Sometimes it can progress to liver cancer. Alcohol can affect the brain. There are several problems associated with alcohol, so excessive use of alcohol is not a good idea for anybody.
I'll come back to this. You talked about, eating a lot of carbohydrates.
Yeah.
Our food, a lot of the things
it's too carbohydrate
Yes.
rich.
So what do we do?
We need to moderate the quantities. The most important thing is about checking your weight and making sure that your weight is within acceptable levels. A simple way to do that is to get your height and then get your weight, and you can divide your height by your weight, you square your weight. This is a bit of calculation, but we call something BMI, body mass index. You keep it below 25 and above 18. That is perfect. Anything above 25 to 29.9, you are overweight. You need to do some more work, your diet, your exercise levels, to be able to bring the weight down. Once you hit 30 and above, that is obesity. And hypertension is directly associated with weight gain. As your weight increases, your blood pressure increases. And so that is also an important thing. So it's not just, yes, we all agree that our diet is a lot of carbohydrates. But what happened to the so much fruits we have around, the vegetables we have around? People want to eat anything that will fill their stomach. But it's high time you started thinking, how is that going to help me when it enters my body? It's not everything that needs to enter your body, because it is not going to help your body. That we have to make conscious choices when it comes to our diet.
Okay, so on that note, we'd also like to mention how people who are at the workplaces, this is affecting them. They are not getting home early. They are eating very late. Late night eating also adds to this obesity, which goes on to give you diabetes and what we call the metabolic syndrome. So workplaces can now try to fashion healthy workplace regimes. There are some workplaces in Ghana, I don't want to mention names, they have gyms inside their offices, they have restaurants which try to get caterers to prepare healthier diets for the workers, so that even if they don't have to leave the workplace, they can eat healthy there, and then before they go home, they can actually start using the gym before they get home. So all of these things help. So we have to start having this discussion with our companies so that they think more about about a healthy workplace.
Doctors, can I take you back to the issue of weight and diet? Let's start with diet. I mean, you've talked about how important it is for us to, moderate the quantities and put the right things into our bodies, eat more vegetables and fruits and so forth. the truth is that sometimes it's not a choice, or the choice is made for you by your pocket. Right? Yeah, because vegetables and fruit are expensive.
Right.
So, I mean, this average person listening to us right now who wants to be healthy, honestly, what kind of medical advice can you give them to ensure that no matter their pocket, they can still have healthy portions on their plates?
Thank you very much. That's a very difficult one. But the most important thing is look at, I mean, there are several fruits around, and fortunately for us, we are in a place where certain fruits come at certain seasons and therefore they become cheaper. So try to go by the season. If around this season, I mean, now when you walk around, there are several mango trees, mangoes are falling around. In that case, take advantage of that. If you go for more expensive fruits, that will be difficult for you. And then a lot of us have backyards, we are not doing anything there. You can just gather some black soil and start cultivating some of these vegetables at your backyard. That also helps you, because sometimes even people who cultivate it, you don't even know what sort of chemicals are being used in cultivating some of these things. So those of us, people nowadays like tiling the whole house, but you could have saved a portion of the house and use it more judiciously for your health. And that's why I mentioned the fact of making the choice. It is your choice. Once you make the right choices, I mean, sometimes I know a friend, he just gathers black soil into sacks, and is able to cultivate some of these things in those sacks and harvest them for his home use. So that is also very important. And then Dr. Tagoe mentioned our workplaces. Some of us, the choice is out of our hands because we come to work like 5 a.m., 6 a.m., and we are leaving at 8 p.m. And you see people, or you hear people eating fufu and banku and other things at 8, 9, 10 p.m. That is not going to be healthy for you. And that is why I think 5 years ago or so, in the World Heart Day, we emphasized the importance of companies supporting their workers when it comes to these healthy choices. If you have people here who are cooking healthy food for them, and even if it demands taking some portion of your salaries to help you eat well, at 5 p.m. you take your supper, you are done with it. So if you close even at 9 p.m., you go home, just take some water and sleep. So it is all about choices. Sometimes exercise, people say I don't have time to exercise, but we pay people to wash our cars when we could have washed the cars, spend some 10 minutes. That is 10 minutes of exercise. We send people, those of us who are fortunate enough, we send people to go to places to go and buy food and bring them to our offices, when you could have taken a 5-minute, 10 minutes walk to where the food is being sold, eat it, walk back. That is exercise incorporated into your daily activity. Your floor may be 3rd floor, 4th floor. Instead of taking the lift, you could have taken the stairs and walked there. That is incorporating exercise into your daily life. So there are ways you can make right choices to help your health, and that is what we are emphasizing.
Now, the obesity. I think I'm not the only person who can bring to mind one person they know who has died from a stroke or some other, hypertension related, condition. And the people I'm thinking of, none of them are fatu. None of them are, none of them looked visibly overweight. But they are dead now. They had strokes, they had, heart attacks, and they were young.
Yeah.
What is it that is turning around what used to be the very easy indicators, like, people being overweight, people being over a certain age? Why are these things changing today?
All right.
So in addition to the unhealthy diets, if you are not seeing it grossly as a patient being obese, usually this also tends to increase your cholesterol levels. So you realize that these people will go, and most of them do not check, but a few people who will check, their cholesterol levels are so high. And cholesterol works hand in hand to destroy your blood vessels and create what we call the clots, which tend to also give you the heart attacks and then the strokes as well. So we need to, like I said before, everything you eat that does not come, let's say a calorie in, does not come out through exercise. Everything is stored as fat. We have some people that they have the fat sitting in their liver. We call it non-alcoholic fatty liver disease. But the main thing is that the cholesterol tends to deposit on your blood vessel, the surface of your blood vessels, and then they cause problems there. Either narrowing, so blood is not able to get to the brain, and then that's what we call the two types of stroke. That it causes the infarctive stroke. Before we have the ones that there's so much pressure generated in the vessel actually bursts, and then you have blood pouring on the surface of the brain or within the brain, which we call the hemorrhagic stroke. And that one tends to kill people even faster than the first one I mentioned, which is the infarctive stroke. So you may not see it grossly that you are putting on weight, but you need to check your cholesterol levels. And usually we have that problem with people who are a bit slimmer. They come to the hospital, you give them the labs, they come back, cholesterol is so. I said, doctor, but I'm so slim. I was like, yes, those who are bigger, they are worried, so they are always watching their diets. But those who are a little bit on the slim side, they think they are fine and they don't check. And usually those are the ones who have very high cholesterol. I also mentioned here that there are some people who are born with high cholesterol levels already, which we call the familial hypercholesterolemia. So you check their cholesterol and they are way above 7.58. So they have a genetic tendency. So we need to be doing our annual medicals as well. At least every year, just try to check your cholesterol level, your kidneys. You have to look at your liver, look at your urine. When you're also developing kidney disease, you tend to start seeing some things in the urine that will alert you. And these things will help you to know what your risk factors are. It helps you to know your numbers. You know your cholesterol, you know your sugar, you know your blood pressure, you know your height, weight, and then your BMI. Knowing your numbers can be life-saving.
And maybe just to add a bit to it, when we say obesity causes hypertension, it does not mean that if you are not obese you cannot develop hypertension, because there are other risk factors to developing hypertension, and we've mentioned quite a number of them: excessive alcohol use, smoking, and stress levels. In fact, some of us sleep deprivation. A lot of us, because we are going to school, we are doing all sort of things. Some people are doing some 3-4 jobs in a day, and there are targets to meet, so they are always under stress. That can also increase our blood pressure, and there's a genetic component to developing hypertension. So your mother, father has hypertension, your risk of developing hypertension is also high. So there are several other factors that lead to the development of hypertension, not just obesity.
If you just joined us on the Super Morning Show, we're asking the question, are you dying inside? Find out if your heart is a ticking time bomb because of hypertension. It's not just your heart, your brain also could end up suffering the effects of poorly managed health, which leads to hypertension and all the complications that ensue from that, including strokes, etc. Our guests, Dr. Emmanuella Tagoe and Dr. Francis Agyekum, are properly taking us through the education today. Now, one of the disturbing statistics Winston shared earlier was that of the 600,000 odd people who are being diagnosed with hypertension every year, about 30-something% of them are not even taking their medication. That is a shock to me.
It's even higher.
I can imagine, but I'm not getting the logic. You are doctors. People come to you, they talk to you. Tell us, what reasons are they giving you for not medicating a disease that could kill them?
Okay.
We actually did a study, I think 2014 in Kolebu Teaching Hospital, looking at hypertension control and non-compliance among patients who have hypertension. Even for those who have been referred to Kolebu, I'm assuming these have higher blood pressures. And you realize that lack of education is a major factor. People don't appreciate the significance of controlling their blood pressure. They think that, okay, hypertension is not causing any symptoms. Usually we are used to, I have malaria, I have headache. When I take treatment, my headache goes. You are telling me that I have a disease that is potentially deadly, but I am not feeling anything. And you want me to take medicine every day of my life. In fact, just yesterday, there was a patient I was having a conversation with. And the patient was like, do you want me to take this medicine every day of my life? And I was like, don't you eat every day of your life? So it is important to appreciate the importance of the disease. So lack of education. The other thing is also about fear of complications of medications. People are afraid that, and especially for the young men, if I take the medicine, my manhood is going to stop functioning. And therefore, there is some truth in it. In not all the medications. Some of the medications can be associated with some of these problems. But the issue is that that will take us into more technical details. But your doctor can always adjust the medications to help you, because the modern medications are quite effective and are not associated with this erectile dysfunction and other things. But the truth is also that hypertension by itself can lead to erectile dysfunction by narrowing the blood vessels that supply blood to your penis, can cause erectile dysfunction. In addition, several other things, the stress associated with disease itself can lead to erectile dysfunction. So, and then the other thing is, let's say your erectile function is perfect, and then you develop a stroke, half of your body is dead. To what use is your erectile function? So it is important.
Half a loaf.
It is important to preserve your whole body rather than focusing on one aspect of your body, and for that matter, losing the whole body. The other reason people gave for not some, medics, our research so far focuses on control of blood pressure. Unfortunately, we have, I don't know the word to use, counteracting messages, or messages that are promising people cure. So if you take this my medicine, you will be cured. If you take, and I have had patients who went for certain herbal medications believing that they had been cured of their hypertension and coming down with stroke eventually. So it is important for us to try to educate people about this. And the other reason people are not taking their medications is also sometimes affordability. Some of the medicines are quite expensive, especially if you go to the community pharmacies. Some of them, the markups are too much. So our dear pharmacists, please. These days, patients are complaining that, doctor, can you change this medicine for me? Doctor, can you change this medicine? Because partly due to the economic crunch, we are also suffering. Medicines that used to cost sometimes 400 cedis are now costing about 1,000 and over. It makes it difficult for patients to also comply with their medication. So there are multiple factors why people may not take their medication. But I think education is a major factor, and also sometimes accessibility as well.
Yeah, making further noise on these factors. Some of the patients too, because you do not have, talking about the fact that you don't really have symptoms, they will tell you that, oh doctor, now I mean who said BBI, so I take it when I feel like I'm having a headache. That is wrong. The headache means that the pressure is worsening, so you shouldn't wait. It's the medication that is keeping the blood pressure down, and it's not going to give you any symptoms until you have the complications like stroke and kidney disease. So don't say that when I start feeling tired before I'll take my medication. Please try and take it every day. And then we also have the other group that they are so, I don't know whether I say prim and proper, their medications are finished. They are supposed to come to the hospital, but it's like you have to come to the hospital in a week's time. Instead of getting more medications using the boxes that the medicines come in, or maybe your old prescription, they will tell you that they are waiting till next week for them to come to the clinic so that a new prescription will be written for them. That 1 week that you are waiting to come to the hospital to get the refill, something can happen. And I have a personal experience of that. As early as SS, I was watching, my grandma was sitting by me. That was my first experience with stroke, and she just fell on her side. When she fell on her side, my mom ran over, and then she was like, "Have you taken your medication?" She said, "Oh, chofa eta, it was my hospital next week. At that time, it was too late, and unfortunately, so she said the medication got finished, but she was waiting to go to the hospital the following week to get a refill. And unfortunately for her, she had a bad type of stroke, that the blood vessel gets burst open, and then the blood comes out, and you bleed into the brain. That was the last time I saw her. And anytime I remember my grandma, I just remember how she fell on her side. And then she said, my mouth is feeling heavy, my tongue is feeling heavy, before she lost total control of the speech. No. She didn't come back from the hospital. So please do not wait for your medications to get finished. Take the boxes to the pharmacy and please get a refill.
Dr. Emmanuella Tagoe and Dr. Francis Agyekum are our guests, and they're answering the question, are we dying inside? Well, you probably have questions too, having listened to all the education they've given so far. Salifu is on the line from Koforidia. Salifu, good morning.
Good morning, Kojo. How are you?
Day for you. How are you?
I'm also fine.
So, go ahead.
Thank you very much for bringing the two doctors for our education. I am a stroke survivor, and I see the importance of what they are telling us this morning. This morning, what I want to say is people should take it seriously, the advice that they've given us. And Kojo, it is not only the hypertension. If not our experience from this stroke disease, I never knew about the A1C glucose test. And the fact,
HbA1c.
Yeah, the test that shows you that you are to get diabetes, and the FBS. All these things you will not know until you get this disease. So it is very, very serious that they continue to educate us. Secondly, the cost, as doctor said, the cost of the medication. That's why people are going for this herbal treatment. And when they go, they become worse. I've been going for physical exercise, and we see all these things. So it is very, very serious that education continues. Thank you very much, Kojo.
Thank you, Salifu. Thanks for calling us. All right, let's take another call. We're going to Kaswa for this one. Hello, Ekua. Good morning.
Morning, Kojo. How are you?
Not bad at all. It's great to have you on the show.
Okay.
What's your question?
So my question is about low BP. Constantly recording low BP, and then you have the symptoms of dizziness, migraine, and then I don't know, is there any cure for that? It doesn't matter how active you are in the morning, you keep reading maybe 70/60 or 80/75. The best would be 110/80 or 85. That is after workout. And you are being advised to take in maybe coffee or maybe a slight pinch of salt to make you relax. How true is that?
Thank you for your question, Ekuya. We'll get you an answer from the experts. Let's go to Sandema. Wow. Jerome, how is Sandema this morning? Have we lost Jerome? Yeah, it sounds like we've lost Jerome. Please call us back, Jerome, if you can. We'd love to hear your question. You know the numbers, 0302 216 541, 055 1111 997. We've got Sybil from Adabraka. Hi, Sybil. Good morning.
Good morning.
Thanks for calling.
I'd like to find out how true, you spoke about cholesterol. So I know people take in coconut oil, like daily. I know someone who takes in a teaspoon a day, and it said that it has good cholesterol, and that reduces the bad cholesterol in the body. So I want to find out how true that is.
All right, we'll get you an answer to that one. Sybil, thanks for calling. Big Joe is in Navrongo. Hi, Big Joe. How are you?
I'm fine, Koyo.
Good. How's Navrongo today?
Oh, Navrongo is fine.
Solid. Okay, what's your question?
But thanks for the opportunity and good morning to you people for this great job you are doing. My question is, what is the relationship between salt intake, Maggi intake, and then hypertension? And then another question is, there are instances others even complain that they take some of the drugs and they are rather having side effects like headache. Is it possible, and what is the best recommendation for such people?
Okay, Big Joe will get you answers. Thank you very much. And we have another Ikuya this morning from Kumasi. Hi, Ikuya. Good morning.
Hi, good morning.
Thanks for choosing Love FM. What's your question?
Please, my question is, high blood pressure patient, and one thing I've noticed about my pressure ups and downs is it's only when in my menses, like probably when I have about 2 weeks to my menses, I realize my pressure goes too high. So I want to find out if there's a way out. Am I live, please? Because
say that again, please.
I was asking if I'm live. I'm on air.
Oh, yes, Ikuya, you are live on Joy.
Okay.
Yeah, thank you so much for your question. We'll get you an answer, okay?
Thank you.
All right, that's Ikuya from Kumasi. Let's come to South La. Hi, Chidiak. Good morning.
Yeah, Koji, good morning.
What's your question?
Yeah, it goes like this, that the blood vessels is more or less like a pipeline that water flows through it. When it gets blocked, it's going to develop these problems. Because if you take notes, with the pipelines periodically, they pump things through it and they wash the dirt out of it, which is a settlement in the veins. What medicine can the doctor recommend that periodically you can take that can wash through your blood veins? Thank you.
Okay, Chidiak, we'll get you an answer to that. Ben is on the line. Hi, Ben. Good morning.
Good morning. I think the one thing that the doctor didn't touch on is family history. Family history is a very big factor. A lot of us, we don't know what illnesses is coming from our genetic line. Then also, when it comes to also the medication, I think some medications work good for black men, for black people than white people. So they need to shed some light on what is that a problem. I take blood pressure and X-Forge is good for me, and I've switched it to a lot of my friends, and it's working for them. So can they share more light on the genetic factor and also the risk factor and family history?
Okay. All right, Ben. Thanks for that. Thanks for calling us as well. Listen, let's see if we can get answers to these questions. We've got about 6 or 7 questions to deal with. So let's come back into the studio, see if we can get some answers from our doctors. All right. So Salifu just had a comment, so that's fine. But Ikuya wanted to know about low blood pressure. She says no matter how active she is in the mornings, she tends to register low BP. She gave some very low readings, actually, 70 over something and so forth. She wants to know what can be done to deal with that.
All right, thank you. So low BP, usually when normal blood pressure is between or above 100 and then lower than 120, that's the perfectly normal. Between 120 to 139, we say you have pre-hypertension. If your blood pressure systolic is below 100, then your blood pressure is low. And especially Ikuya said that she has dizziness, which is also associated with low BP. There are a lot of causes which I cannot know specifically in her case. So it's important that she sees the doctor and then they investigate her appropriately to find the cause. Also make sure that you are taking adequate amounts of water. Sometimes when you are dehydrated, your blood pressure also goes down. And so in addition to whatever you are doing, make sure that at least about 4 to 6 glasses of water a day. Our weather is hot, so we tend to get quite dehydrated, and it brings our blood pressure also down. And there are other things the doctors will do to find out what is exactly causing the low BP, and then we can tackle that one.
She says some people advise that you take a bit more of salt and coffee to actually deal with that. And
sometimes for specific people, we give that specific advice, but that is after we have been investigated and we find that this advice will help you. It is not for everybody.
Right. Okay. Sybil wanted to know about cholesterol in coconut oil. She's been told that it is good cholesterol which will flush out the bad cholesterol. True or false?
Okay, so the debate about cholesterol rages on, about which ones are healthy and which ones are not. From the studies that have been done recently, they come out that coconut oil, and that one too, they actually qualify it as virgin coconut oil. And then olive oil, the avocado oils, those are good. I'm not sure about taking it in directly. What I know is that they are trying to encourage that we use it to replace the oils that we normally buy from the market, the other vegetable oils that we are not sure about their content. So coconut oil, olive oil, avocado oil, all these things have been postulated to be the healthier oils. And then if, is it Sybil wants her level of good cholesterol to increase, another way to do that is by exercise. The more you exercise tends to convert your bad cholesterol, which we call the LDL cholesterol, or low density lipoprotein, to the high density lipoprotein, which is what we call good cholesterol and bad cholesterol. Maybe we are explaining to patients. So I think you should just replace taking the oil in directly with rather cooking with it, and the cooking too shouldn't be too long so that the oils are not transformed into what we call the trans fat, which now become unhealthy. And then you should exercise, increase a level of activity to convert all the bad cholesterols to the good cholesterols.
Okay.
So basically, there's no evidence that by ingesting good cholesterol or good oil directly, you will decrease your bad cholesterol in your blood. No.
It's just advisable to replace your cooking oil
exactly
with the... Okay, all right. Thanks for that. Big Joe wanted to know the relationship between salt, margarine, and hypertension.
So I think we mentioned it earlier on. Salt is directly proportional to hypertension and all forms of salt, especially the sodium content of salt. So the higher your salt intake, it sort of pulls water to it, and though increases the blood volume, increases the blood pressure. And especially for blacks, we are more sensitive to salt. And so if your salt your salt intake is high, your blood pressure is also high.
Doc, a lot of people like Kobe. They like Kako.
Yes.
They say
unfortunate facts.
They say that is, you can never have MPC without these. Is that also a problem?
It is a problem, and indeed, what we can rather do, I mean, if it's about the Kobe you like, you could soak it overnight, let the salt get out of it, throw out the sauce, and then just enjoy your fish. But even then, don't do it too frequently because they are too salty. In the same way, we don't advocate that people go and buy, I don't want to destroy people's business, but fast foods, because people tend to add too much salt to fast foods to stimulate your taste. These are not good for us. There was a study done in Ghana, Kumasi, by late Prof. Planjuru and co. They compared two communities. One of them, they were taking high salt, and then the other were taking normal salt. And you realize that those taking high salt had higher average BPs than those who were taking normal salt. So these are facts that have been documented.
Now, Big Joe also wanted to know about side effects of some of the hypertension drugs. He said, do the side effects include headaches?
I think some of them have side effects including headaches, maybe you have some a little bit of leg swelling, but when you come and talk to us that you are having these medications, we have a wide range, so we can change it. But I also wanted to mention that hypertension on its own, when you are not taking any medication, untreated hypertension can give you headaches, can make your heart beat faster. And usually when you start having this, we don't want you to get there. That's why I want you to check your numbers. But when you start having these things, you have to go check your blood pressure. So we have some that can do that. If it's really serious, we'll change the medications. But so it has to be a discussion between the client and ourselves. Let's keep talking. Let's not keep the side effects to ourselves.
Okay. Ikea called about high blood pressure, but she says it only tends to happen when she's close to her time of the month. Is that a thing?
I really don't think that it only happens, but maybe it goes up higher when she on the second part, and this is due to the hormonal changes that are associated with our monthly menstrual cycle. So that is well documented. You just have to know how to control your blood pressure well, how to control some of the other things you are doing, and things will be fine. So it's purely hormonal, and that is well known.
Someone texted me that Ikuya should just move from Kaswa and everything will be fine. All right. Chidiak wanted to know, he said to him, blood vessels are like pipelines through which your blood is flowing. Yes. So what medication can a person take to wash through these pipelines to avoid blockages and so forth?
Well, I think the medicine is called eating more fresh vegetables and fresh fruits, because with all the healthy diets and fat diets going around, you actually see people now consuming more what they call the smoothies. So they actually blend fruits and vegetables and make them into smoothies to detoxify their systems. So if you don't have any of these risk factors, or maybe you do, don't try to rely on medications now. Maybe they haven't manifested into the overt disease conditions yet. Take in more vegetables. If you cannot chew them, then you can blend them into smoothies and take them. More fruit. There are so many combinations. You can go online and you can do this. Yeah.
So if you take the blood vessel of a 10-year-old child, it will be so clean.
So nice.
No problem with it. As we grow, because of the several risk factors we've mentioned, our eating habit, our drinking habit, our smoking habit, we start building what we call cholesterol plaques, atherosclerosis in the blood vessels. These are not reversible. And so at whatever level you are, you can slow the progression. And that is the message we are preaching. Try to slow the progression. There's no medicine to wash the blood vessels and return it back to that of a child.
Okay. One more. Ben was asking about, he brought up the issue of family history. He said that is also a causal factor.
I think we actually mentioned it, and that is part of the
especially first degree related, that's your parents or your siblings.
But these are not modifiable. And so our focus here is try to educate people on the modifiable risk factors, and those who have it, as she rightly said,
so people like that, you can start checking your BPs from when you are like 30 years. Every 6 months you can have a BP check. When it starts going up, you talk to a doctor.
Okay. Ben also wanted to know whether there are some drugs which are better for black men. He said he has been recommending some drug to his friends.
I will advise him to stop recommending drugs to friends. Let them go to hospital, get it well diagnosed, investigate to find out what are the other problems the person has. I mentioned earlier on that it's not you don't treat everybody the same way. If you have hypertension and diabetes, you have hypertension and early kidney disease, or you have hypertension, there are several other things your doctors will look at before they decide that this drug is the most appropriate for you. This drug may not be the most appropriate for another person. So we wouldn't advise him that he should be recommending drugs to friends. If we are managing you, we look at so many things before we decide on what medication is appropriate for you.
So we call it an individualized approach to everyone. One size does not fit all.
That's important.